Welcome, everyone. Thank you so much for joining us today for our National Patient and Family Engagement Learning and Action Network Peer Connection call. Today's January 25th, 2024. If you are unfamiliar with this call, it's a call series. We hold one quarterly with a focus on, I know it's peer connection call, but with a focus on caregiving, care partner, peer connection. So for those who have never joined us today, we're excited to have you. And we look forward to the information to share with you today. So just a few logistics to get started. If you are not muted, please do mute your line. Just helps reduce any background noise. We can help you mute and unmute throughout the call if need be. As always, this call is being recorded. It will be made available to the public, so it will be on our website. We also will share it in Basecamp. This topic for today often brings up a lot of personal experiences, so we do ask that you do not disclose any personally identifiable information. We ask that you do not give or ask for medical advice. As you all know, each person's situation is very different and unique, so we just want to be mindful of that. And before you make any changes to your health practice, please make sure you speak with your healthcare team. And then we do have a disclaimer here, because we do have panelists that attend these calls. We want to make it clear that the views and opinions that are expressed during this call are those of the panelists and do not necessarily reflect the official policy or position of the End-Stage Renal Disease National Coordinating Center or the Centers for Medicare and Medicaid Services. Any content provided by the panelists is of their opinions and is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. So as usual, your moderators today are myself, Emma, and Stephanie Hull, if she's able to get her audio working. And again, welcome to the call.
Here.
You're here. Yay,
had to switch over to my headset though, so I apologize for that.
No problem. Thank you so much for being here. We do want to send out a quick shout out, and we'll be sending out some more information about this, but February 16th is National Caregivers Day. This is a day that we honor and celebrate those wonderful folks in our lives that are choosing to be caregivers, care partners, to family, friends, neighbors, strangers. Without our wonderful care partners in this world, none of us would be where we are. So we just take that day to celebrate them. And we will be posting some more information on that as Basecamp as we get a little bit closer. So today's call, if you are familiar with our calls, is going to be a little bit different. We had a wonderful individual, Dorothy Jackson, volunteer to share her care partner journey. She is from Network 18. Unfortunately, she is unable to join us today, but she was able to provide us with some incredible information about her care partner journey. So we will be working through that information. As we work through the information, though, we do want to hear from you. So if you are a care partner, if you have a care partner, or if you just have some insight that you would like to add, please do use that chat, and we will make some time available for folks to come off mute. So as I mentioned, Dorothy Jackson, she is a care partner currently for her husband of 46 years, and she's been his care partner for 6 years. And she identifies herself as a wife, mother, and a professional. So we presented Dorothy with some questions about her journey into becoming a care partner, coping strategies, what she wished she would have known, what she has gained from the experience. So most of this information is directly from her mouth. In other words, she typed it out for us. So the first question was around the transition to care partner. What was that like for her? What changed? And her responses were that for her, she didn't think of herself in a different capacity. Nothing really changed. And there's a quote here: for me, when you love someone and you realize your help could extend their life, then all options are on the table. So she really took this position with stride. She was very determined to make it work 6 years ago. The how. So how was she going to make this work? You know, she was a mother, she was a working professional. She had her own needs and her own life that she was also living, as well as being a wife to her husband. So how was she then going to transition into being a care partner? And what she did is she made a list of how she was going to make it work using her current traits and skills. So she really took hold of what she already knew she could do well. So she knew she was a nurturing and caring mom and wife. She has learned a lot from her past experiences, both personal and professional. And she has some incredible career skills. Those included time management and organizational skills. And she used all of these different traits and skills to make that transition into a care partner. So I want to pause real quickly here so we can make this conversation a little bit more robust. And I see some people are putting in the chat, Anthony was a caregiver for his mother and also his aunt together. Thanks for sharing that, Anthony, and being that caregiver for them. But I would be curious if you all would use the chat of if you were a care partner, if you have a care partner, how did you become that care partner? What did you do? Did you use some of those traits and skills that you have? Did you go out and find a lot of resources? What worked well for you? Anthony said his experience helped him be a better care for himself in his condition. Thank you, Anthony, for sharing that. Absolutely. I can see some people typing, so I'm just going to give folks a couple more seconds. And Stephanie, feel free to come off mute at any point too. Let's see. Lisa has had 2 care partners. Her former husband was a retired banker, was very organized. He died 3 years ago. Sorry for your loss there, Lisa. And she has a second caregiver now, who's a cousin who works for Nike. So he himself is also a care partner and a professional, and a cousin. He's may have a family. And that was, one thing that we took from Dorothy's information, and Lisa's making a good point here, and so did Anthony, of no one is ever just a caregiver or care partner. They are multiple things, multiple people, their husbands, wives, their children, their professionals. And so there's many hats to wear. And that's something that Dorothy got into a little bit later. Lisa said she needed a back plan if someone passes away. Mary Ballaker, welcome, Mary. She was a care partner for her dad and stepdad, and it was an honor to be a part of their life and care. Absolutely. Thank you all so much. Ken states that his partner is his care partner. Thank you. All right, please feel free to keep put in the chat. We'll be monitoring that. So we did want to ask Dorothy how healthcare providers can help support the transition. So whether it be what was helpful for her or what she would have liked to have seen. And her biggest overarching statement was that healthcare providers need to inform patients and families. And some of the examples that she put were inform them that they are part of a community and they're not alone in their journey. That they have support, there's information out there, and that they have a voice. And just reminding them of that. Sharing information about peer group mentorship, caregiver resources, and support groups. And then she felt that having the care team schedule follow-ups with new patients and determine how things are going. So I think oftentimes care teams will meet with patients initially, and then if everything's going well, then the follow-up maybe doesn't happen for like a month or so, but scheduling it more regularly. I'm going to grab a few more things from the chat. Anthony learned that being a care partner, there are a myriad of services and help available. Absolutely. Lisa adds that there's individual growth and spiritual growth, and it's so important. Thank you both. So coping, and this is another area that I would love to hear some insight from you all in the chat, but we asked her how did she adjust personally and what resources did she utilize in order to reach that point. So these arrows here are the two areas that she implemented to help her adjust. So she searched her heart and redefined her priorities, and she found comfort in her faith. Those were two very important things for her. And then the resources that she utilized to utilize those coping mechanisms were her faith again, her church congregation, and for her, her husband is a veteran. And so she utilized the VA support groups and resources for caregivers of veterans. And I think that was amazing that she was able to tap into that resource, that she knew about them, and it's been successful for her. And we will share some of those resources with you at the end of this call. Would anyone like to? Oh.
Yeah, I was wondering, do you think that the model, I know that Kubler-Ross has a 5-stage or a 7-stage of grief model where they talk about denial, anger, bargain, depression, and then eventually get to acceptance. You think that that has a play in any of this?
I think that's a really good point, Neeland. I think when people think about grief, they assume, someone's passed away, but grief is something that we all experience in our lives, whether it be loss of someone or loss of a change in their status, so a change in their personal life. Absolutely, I think that could be something that a lot of new care partners and those that they are caring for equally go through, whether it be in the same stages parallelly or just separately.
Yeah.
I think that's a really excellent point.
Yeah, I think you're spot on that, because I know, just speaking personally, when I first got on dialysis, it was pretty traumatic. I said, "There's no way. I'm too young for that. I'm not 80 years old." I was in denial, big time, and all of a sudden, all my plans had changed. How I would do things would change, and I had to get to a point of acceptance. That, hey, this is what it is, and it's about quality of life and survival, and making it easier for my wife, who was my caregiver at the time. Now, as of today, I have a kidney, so I've gotten a kidney transplant, and I'm going through the same thing again, because now it's adapting to the new kidney. The first 6 months can be a real challenge. So, as you mentioned, the Kubler-Ross model doesn't always apply to bereavement, but change. And that's something that we all, as adults, get a chance to tackle sometimes.
Absolutely. Thank you for sharing that with us. And to add to that model, it looks different for everyone. The stages, how frequently you go through them, whether you reach acceptance, it may be just for a month or so, and then maybe new grief comes in. So it's important to understand that.
And I wanted to also add that they're also not always in order.
Absolutely.
Yeah.
Absolutely. Thanks, Ken. We have some folks in the chat here saying the importance of having a community, people agreeing with you, Neeland, about grief, acceptance that your identity has changed. Mary Ballaker noted that she learned a lot about resources that were available to support her dad. Veterans Affairs, hospice, in order to stay at home, respite. Kim, you're making a good point that going from dialysis to transplant, you're definitely switching gears. Your life is quite different, and so that can be another grieving process as well.
Yes, definitely.
Thank you all so much. It says, yep, and Ken said vice versa. Yes, absolutely. Thank you all so much for this conversation. So the next thing that we wanted to ask Dorothy about were, what are her most common stressors as a care partner to her husband? So she mentioned 3: when to rest and restore herself, so when to really take care of herself; managing time, so keeping up with dialysis, other appointments, her own chores in the home; and then questioning whether she is doing enough. And I think that is such a big one, and I appreciate that she points that out, because I would imagine that for so many care partners, that is a regular, mental stressor. It's a mental load of wondering if you're showing up in the best way possible for the person you're caring for. So I appreciate that she mentioned that. And then we wanted to know, how did she cope with those stressors? What did she do? As you see here on this pie chart, one of the sections is listed out. This was one that she mentioned 2 or 3 times in the information she gave us. But she put that she gets up early for private, quiet time in prayer, reflection, and direction. So really carving out that time that's just for her, that's quiet, and that was early in the morning for her. And again, that might look different for everyone, but that was what was most important and how she copes from the day-to-day stressors. She's also learned that having patience and being flexible helps avoid some stressors. Absolutely. She rests while husband rests. I love that she put that in there. I think that's such a really missed opportunity, but also it can be an opportunity that maybe some care partners don't have. Maybe they've got kids they have to take care of when the person they're caring for is resting, or they have their own appointments. So that works well for her, but maybe not for other folks. And then she does things that she enjoys. So she makes sure she gets that mental stimulation through puzzles or online games. And then thinking towards the future, she would really like to start a garden of plants and vegetables. And I absolutely love that she put that in, because that tells me that she recognizes that this position is something that she's going to be in for a little while, but she is thinking forward of ways that she can take care of herself and bring joy to her world. So that was wonderful. We have some folks in here saying time is critical. Thank you, Neeland. Managing your time, energy is draining, and you need to draw from your well. Love that, your well, to re-nourish yourself and sleep and rest. Absolutely. Anybody have any other thoughts on how to cope with stressors of whether you're a care partner or just having a lot of things on your plate? Find ways to release stress. Absolutely.
Well, one of the things that I've been
Exercise.
doing, someone just put it in the chat, Michael. Thanks. I was doing exercise for the last 3 years, and I got into Tai Chi, and that helped me a lot.
Wonderful.
One of the things I would do Tai Chi while Albert would be at the gym doing boxing, and so boxing helped him a lot with getting a lot of stress out.
And that's such a good point that you're making, Ken, of oftentimes your stress reliever may be something separate, either because you all need some separate time from each other, or your interests are just different.
Well, yeah,
But
because we
both of
always
those
say
are filling your cup.
he has his life, I have my life, and then we have our lives together. So, and that's the way we work things out.
That's beautiful. Thank you. Walking, bike riding, so lots of physical activities. Bowling, I love that. Thank you. I think some people might get some ideas from everyone sharing, so we appreciate that. So what do you wish you, apologize for that. What do you wish you would have known ahead of time? So this was something that was really important for us to learn from Dorothy. She's been in it for 6 years now. So they have a routine. And so hindsight is kind of 2020, so what would have been beneficial for her? And we have a quote that was from her, and it's, having a positive attitude transcends from the caregiver to the patient. And I love that. So her big point was that a caregiver wears many hats and has many titles. One of those was being a positive motivator. which helps herself and husband see good in the midst of the difficult.
Hello?
So, yes, hi, welcome. One of the other hats that she wears is time manager. So again, all those many different appointments for her husband, but also probably for herself. And then being a dietitian, you know, understanding the liquid limitations, the diet, which ultimately impacted his lab values. So for her, that was something that she wished she would have known ahead of time, how many different hats she would have to wear, I apologize. I see a few, let's see here. Lisa noted that something she would like other people to know is that training of any kind can be sparse. Yeah, I think that that's a really good point, and it really just depends on, you know, the world that you live in, possibly the dialysis facility or transplant center that you're connected to, what's available in your county and your state. That can definitely vary. Michael wrote, it's a tennis match and a ball of positivity or negativity can be bounced back and forth from caregiver to patient, vice versa. I like that analogy. Thank you. And Lisa puts the impact of renal food. Neelan added that being patient is important. You get to know your body's needs, self-advocate when things aren't right. Absolutely. Thank you so much. And then lastly, we wanted to know what was most rewarding for her. Because as many of you know from either being care partners, being parents, it's certainly not all bad. There's so many positives. And for her, the number one was her husband is alive. She gets to spend more time together and bond with him. And she, as many of you have mentioned in here, she got to become an advocate for her husband. So she gets to speak up for him, ensure he's getting the best care possible. And those are the things that were most rewarding for her at this point. Would anybody else like to add something that's rewarding to them? If you are a care partner, if you've been a care partner, if you have one, what's rewarding for you as someone who has a care partner having one?
I think it's important to ask the patient how they feel. What are some of the things that you could do better for them to make them feel more accepted?
That's really good input. Thank you.
That's also a good question to ask of the caregiver, because oftentimes nobody asks them. Yeah. Because I remember when I was diagnosed with cancer, I had to have that conversation with him, because we were in a new relationship. It was, everything was new, dialysis, all that stuff. And it just basically came out of nowhere. And one of the things, I was okay with it. I needed him to be okay with it, in order to make me feel better.
Absolutely. That's a really good point. Thank you for sharing that, Ken. Anthony, I see your hand is up.
What I wanted to share, the thing that I got out of being a caregiver was the joy that I was accomplishing helping my mother as well as my aunt, because my aunt was bedridden. So she required, from what the hospital said, she required 24-hour care. But thankfully, my uncle, he was there, and with his limited abilities, he was still able to help to tend to her. And my mom, I did get her back into being more independent. So I had to rearrange her apartment so she would easily be able to come and go. And thankfully, she had early stages of dementia. So another one of the ladies in the apartment complex, both of them were in these power wheelchairs, and they would go places on a weekly basis. to see things. And I think that that made my mom feel better as well, because she would share some of her adventures with me when she would come back. But I got to admit, it was a lot of work, but the benefit that I did get were the nurses that would come, and they would at least confirm with me that I was doing things right. They showed me how to better do things that helped me out as well, like transferring my aunt from the bed to the wheelchair and going to all of her appointments. And when the County of Los Angeles, they even offered their services to me because I was taking care of both of them at the same time. And I got to know the paramedics because they would come, sometimes with an ambulance. They got to know me. The hospital got to know me. And that it's as if God just put in an entire community to help me, aid my mom and my aunt. So that's one of the benefits that I did learn, is that all of these varying services that are out there, we can find them and they're available to us. And if we need help, they can actually, give us more information. It's like everyone's a social worker.
Yep.
And that was the greatest thing that I got from it. I mean, the biggest amount of help.
Thank you so
Thank
much for
you.
saying that, because I'll tell you, so often, I mean, I'm no longer in dialysis, but while I was there, I would, ask some of the patients that were in chairs near me, why don't you try this? Well, I didn't know. And sometimes people just are bottled up. They don't ask questions. They just have somebody drop them off and do whatever you want with me. I'm like, no, you're still here. You're still in the game. Don't give up. What do you like to do? Do you like to do so-and-so? I mean, on dialysis, I still traveled around the world. I still went to the movies. I still went to dinner. The only thing is, 3 times a week for 4 hours, I was in a chair. Other than that, I tell everybody, live your life. Live a normal life.
Yeah, thank you for pointing that, both of you. And I think it also highlights how different a care partner relationship can look. And so I'm going to the point of Bob Crabtree in here is putting in here that he and his wife are more partners versus a patient and a caregiver. And I love that point that you're making of it. It definitely looks different, and it looks different on the dynamic too, right? It could, if it's a husband-wife or partner-partner situation versus maybe a parent-child relationship or a friend-friend relationship, it's going to look very differently. The resources that you need are going to be different. The training that you get might be different. And so utilizing all the resources that are available to you. So talking to people at your facility, utilizing the EMS folks that unfortunately have to come to the house at some point, utilizing the VA resources, all those things are so important. It makes me think of, there's this idea of compassionate communities. It's very like informal groups of folks in communities. We see it a lot in small communities that they really just want to care for each other. And so when somebody's in need, they all, they come together for the sole purpose of just providing that person a need with whatever care they need for however long they need. So it could be just a day of showing up with some food, or it could be months and months of setting up like a food train or a caregiving routine. So I appreciate everybody's insight here, and I see some more folks have added into the chat. I apologize if I've missed yours. Let me take a quick look here. Folks really like, Bob, your idea about partners in care. Michael put in patient-centered care, absolutely. Sharing when there's milestones that are met. Robert put in here, Bob, sorry, put in here, it's important to remember that they are a couple first. Absolutely. And that's, that's something that Dorothy made a point to make of, she added to her her list of who she is. She's a wife, mother, professional, and now she's a care partner. But she's not just a care partner, and her husband is not just a patient. So she expressed that and wanted it to be known that she is all these things, and all those things are important to her. So thank you for making that point, Bob. I'm going to scooch back here real quick because I skipped over this VA caregiver resource because Dorothy mentioned it. This is one of the resources that she utilized. If you are a veteran or have a loved one that is a veteran, they do have a caregiver support program. And it has two different programs. So you see here at the bottom, they have the program of general caregiver support services and a program of comprehensive assistance for family caregivers. I myself am not an expert in these programs, so I really do encourage you to reach out to the VA. You can go online to read about them, but there is a caregiver support program at every VA facility. So if you are connected to the VA, talk with your social worker, talk with your care team at the VA to get more information and get connected with them if that's of interest to you. A few other resources we do want to point out. We have our patient and care partner resources on our ESRD NCC website. A lot of these resources are resources that are created by you all, by patients, for patients, by care partners, for care partners. And they can span across all different modalities. So we have some about specifically caring for folks who are going through the transplant, those that are on dialysis as well. So we encourage you to take a look at those if you have not. Here are two examples of what they look like. So there's a specific tips for kidney caregivers, and on the back of it, it's important medical information. So just a great way for you to keep track of all the many, many appointments and many phone numbers you may need to know. And then this one, I think there's a few of you on here that were part of this second resource here. I think this is a really great resource. It points out how dialysis could potentially make you feel, and what are some suggestions on how, as a care partner, you can be helpful. So it just gives a little bit more in-depth insight into what it's like to be on dialysis, and it could potentially help reduce any stress or conflict in that relationship by having those suggestions up front. We also have some podcasts through our YouTube channel and on our website that are with care partners. So this was one with Yolanda Moore. She is one of our subject matter experts, and her husband transitioned onto home dialysis. And so she talked about what that transition was like for her. And a lot of what she talked about was how his level of need changed and how she and him had to shift their relationship through that change of him becoming more independent, requiring less assistance to go to appointments because he was doing it at home. So some incredible information that she shared on there. So if you have not listened to it, I encourage you to do that. And I know we are short today because we didn't have Dorothy, so I do want to open up the floor. If anyone had something they'd like to add, share about their journey, or any other thoughts they might have, any other resources that they've used. Roger, thank you for a shout out for Yolanda. She is amazing. We appreciate that she completed that that recording for us, so now we can listen to it year after year.
There are
Someone came off. Yeah.
there are a lot of resources, like obviously our group, but there are also like the National Kidney Foundation. I would strongly encourage to widen the net. You find some of the same information on the different sites, but you'll find interesting information. I would also encourage what we're doing now, networking. It's very healthy and very therapeutic to talk about it. I know when I first got on dialysis, I really wasn't thinking, hey, let me get into a support group. I'm going to be okay. I'm kind of stoic. You know, I'm from New York. Hey, I got this. And I realized, no, I ain't got this. This is different. And, you know, has somebody else been through it before? How did it work out? How did you make it work out? those types of conversations can be had in networking through different groups. And I find these forums very rewarding. There are no stupid, crazy questions that you can ask in support groups because it's something that's dear to your heart. You want to know the answer. And the people that can help you to find solace are on the other phone.
Thank you. I think that's a wonderful suggestion. And I think in this day and age, there's so many different types of resources. So if sitting in a group is not something that appeals to you, there are opportunities online, over the phone, one-on-one, paper form. So just really, thinking about what works best for you, and then finding that resource.
That's correct.
Stephanie, did you have anything you'd like to add? Oh, Lisa, I see your hand is up as well. Go ahead, Lisa.
I think the biggest barrier about this is the sense of isolation as a dialysis patient, and then wanting to talk to somebody or getting to these resources. Now, I'm going on 11 years. I'm independent. And so I've kind of passed the in-center thing. I'm never going to have a transplant because it's against my religion. I'm a Native American. Okay, so that's, we know what road I'm going to go. And I noticed that in my first walk because I'm in Oregon and there were no support groups. I hadn't connected with Peer Connection. At that time we didn't have that. And I just think it's great that we as kidney patients, whether our walk is with transplant, home, in center, no matter what modality that we have, whatever one that works for us and that we're going to do and be compliant, that's the one that we need to do. I mean, there's no sure answer for anybody. Everybody's got free choices, and it's so important to be able to go to somebody. And sometimes, and this goes along with the mental health and wellness, about being ashamed or feeling uncomfortable about asking questions. And so it would be really nice that early on, that if someone reached out to me and say, hey, it's okay, I know you're scared, but you just don't have to get a transplant, because that's all I ever heard. And a lot of fear, I think I would have dealt with very early. And now I'm having to do cannulation here February 5th on my thigh, something that we've been waiting for forever and a day. And so I don't think I would have had this much anxiousness. And that's what we have. We all have some level of anxiousness to whatever degree, no matter what modality or where we are in our journey. And I think if knowing early in the game that it's okay to talk about it, it's great to have these groups. We need to have more of these groups and more open, honest,
That's
open
right.
and honest dialogue, right?
That's right. That's right.
Yeah,
and it's hard to talk about these things.
absolutely. Thank you for making those points, and making yourself vulnerable to sharing that. One of the things that I heard was when you mentioned isolation. And I think that's so true for patients as well as care partners who care for them. It can feel very isolating, especially if you are new to it, or maybe there's not a lot of resources. You can kind of feel like you're in the trenches by yourself. So finding resources, mutually important for both the patient and the care partner. Going back to, again, that cyclical effect of positivity. If one of them is positive, then maybe they can share that with the other. And if one feels supported, possibly the next will.
You're passing that information on, because the people that were kind to me, that received me well, didn't talk down to me, treated me with respect, and gave me some good, solid information. Well, in turn, I helped somebody. And I guess that's why I'm probably part
Yeah,
of
you pay it
these
forward.
various. Yeah, I've been part of these groups because I benefited from this. It was
Yeah.
late in the game, and I said to myself, you know what? If I can help somebody not go through this, or as a Native American Indian, not go through the obstacles that we have to go through at some of these Indian Health Service visits and that's a whole nother issue in itself. And if I can help make it better for somebody else so they don't have to go through the hell that I went through. And you know what? It was worth it. It
Oh,
really was.
Appreciate that,
absolutely.
Lisa. Yes, thank
Yep.
you. And Stephanie, I think I cut you off, so I see a hand up, but I want, nope, okay, you're shaking your head no. Okay.
Lisa, thank you for sharing. That really hit my heart. Thank you.
You're very welcome.
You. Anthony, go ahead. I see your hand is up. Then I'll get to the chat, folks.
Yes, for me, now I have a caregiver, an IHSS worker. I've had to go through a few of them to find this one. And me, when I was a caregiver to my mom and my aunt, I didn't realize now that I have my own caregiver, that there was a lot of things that I had to relinquish because I live alone. And like Lisa said, it is isolation. I've been on dialysis for 17 years.
Ooh.
And I have my own particular way, that I do things and stuff. And to find a caregiver that's willing to help me, that really wants to help me.
Yeah.
And desires it. That was the thing that I'm getting more accustomed to, because she is more adamant about making sure that I am cared for and provided for. And
Wow.
the other IHS workers that I had before this one never seemed to do that. I found myself doing other things extra because of the things that they apparently wasn't doing. But now this caregiver here, I was assuming that, it's going to be the same thing, but it's not. And I'm feeling a bit more comfortable now with this caregiver, and the fact that I do live alone, like Lisa said. It's all of this isolation because there's no one that seems to know what it is that I'm going through. And
Yeah.
it's hard for me to even explain what it is that I'm going through after being on this for 17 years.
Yeah.
Wow.
I've been on it
Mhm.
13 and no one understands.
Yeah. I
Right.
think that's
Not even, I'll be honest, not even my nephrologist. Because they haven't been on dialysis before.
right.
It's almost like you got to be in it to know it.
Yes.
Anthony, thank you for sharing that, that perspective as a patient. I think that's so important. Obviously we're focusing on care partners and how to support and give resources, but I think it's important to hear the patient perspective as well of how challenging it can be to relinquish, as you use some of those things that you independently might used to do, having to put your trust in someone that's a stranger to you, and possibly having to go through several different caregivers, and that I can imagine can be quite exhausting, having to start over so many times. So I'm very happy that you have found a care partner that seems to be a good fit for you. And thank you for sharing that. I'm going to check the chat real quick before we close up and give you back some of your day. Folks are happy for the honest conversation. And I see here, where did it go? Neville put that one of the benefits that his wife talks about is the habit of reading food labels. I love that. That's such a very tangible example of one of the benefits of maybe being a care partner is that you learn a whole lot more about food and diet and those food labels. And I know there's some questions here about transplant in Native Americans. For the sake of the time today, I can see that Lisa sees those, so perhaps Lisa, at some point, we can invite you to share some information about that from your perspective on a future call.
Absolutely. I've done
Perfect.
training. I've
Thank
done the
you.
Native American Toolkit, and I've done lectures on that anytime.
Thank you. We absolutely will have you. Yeah, we appreciate the conversation today. I know this was a little bit different than what we typically have for this call, so appreciate you all being flexible and sharing your perspectives. And before we close it up, Stephanie, do you have anything else to add?
No, not really. I just want to, a lot of good dialogue today. And I just wanted to give a little shout out to Sherry sharing her story in there too about being a caregiver to her husband and what all he went through and she went through with him. So thank you, Sherry, for sharing your story too. So no, great conversation today, everybody. I loved it. Loved hearing it.
Absolutely. Thank you. And a shout out to Dorothy. I know she's not here with us,
Yeah.
but we appreciate her sharing her story and information. We hope to have her on a future call so you all can meet her if you haven't already, and she might be able to share some more insight. And I think I
I
cut
just
someone
wanted
off.
to add one thing.
Yeah.
Neville, I'm sorry, Neelan.
Yes, sir.
There are transplant support groups. What you could do is go to the Transplant Recipients International Organization, and
Okay.
they'll have something that's listed in your state.
Oh, great. Transplant
Recipients
recipient.
International Organization. It's called TRIO.
I'll drop their webpage in the chat here for you all.
Because
Trio.
I'm part
Okay.
of the one here in Manhattan, and we put on the Rejoice and Remember celebration every year in April to
Okay.
honor donors and recipients.
Well, I'm a fellow New Yorker. I'm from Buffalo. I'm heartbroken my Bills didn't make it, but I'm a Giants fan too.
No, you're in my old neck of the woods, so I
Yeah.
understand.
Thanks for sharing that. There is the website. It's TRIO web.org
Yep,
for
I
folks
got it.
that want to take a look at it.
Outstanding. Thanks for
Great.
everything, guys.
Thank you all so much. It's been such a pleasure having you today and sharing your stories. We will be sending out the invite for our next one, probably in the next couple weeks to months, so keep an eye out on that. If you are interested in participating, being a panelist, please let us know. We are happy to have you. And with that, I will give you back a little bit of your day today. Appreciate you all and have a great weekend.